yes, you love the medical field, but what do you want also for your life? And PA just fit that. It fit the type of life that I want. So, hi guys, as you know, I'm Rodeline. I'm the host of eShadowing. So tonight is going to be another Q&A session. We're going to get back started with guests next week. We're going to have a new guest, and of course, onward. You guys know whenever we don't have a guest, I host and I guess be the guest for that session. I either do a case study or do Q&A. And being that, especially since Caspa is opening soon, I figured that it would be great to do another Q&A. And of course, it relates to any questions you guys have about PA school, the application cycle. Not so much maybe the application cycle, since I don't know too much about Caspa, at least how it is now. But anything relating to the PA career and emergency medicine, urgent care, those are my specialties. Alrighty, so let's get started. Yeah, thank you guys. Alrighty, so let me see if I see any questions from earlier. No questions yet. Okie dokie, any questions so far? Okay, see some questions coming in. So how long should I take to study for the GRE? Okay, I always recommend studying at least 6 weeks for the GRE. You know, if you're good at test taking, you're going to do well. Of course, it's like one of those standardized tests, and it's not the most important thing on your application. So if you don't do well, of course, it does not mean that you're not going to get into PA school, but it's just another thing to get out the way and do for PA school. So I always recommend studying at least 6 weeks, and especially if you're not good at test taking, you can definitely do a prep course. Like my favorite, I always say as well, even on past eShadowing videos, is Magoosh. I really like Magoosh. I also like the Kaplan study guides, but as far as like a test prep, like a video test prep, Magoosh is bomb. Magoosh. They're bomb. So I recommend them. And I use flashcards for the vocab because I feel like, you know, repetition is really how you learn when it comes to vocabulary and learning those hard words. And of course, using them in your everyday life. So I bought vocab flashcards, Barron's flashcards, and really use Magoosh. And as far as the math portion, I use Kaplan study guide. And that's about it. I got like a 151 and a 153. I don't remember which I got, but I know I just did well enough to hit the average mark, or the competitive mark. So yes, and that's what I did. I think Magoosh is just like one of the best test prep. Like I just really like the way that they taught me and, you know, helped me learn the material, especially the math that I didn't really know. So there's not really a way to learn verbal. I don't think like it's either you know those words or you don't. You study them, look at them long enough to start remembering them. So that's why I recommend flashcards for verbal, because somebody could tell you what onomatopoeia is, but you're not going to know unless you constantly use it, constantly look at it. So yeah, but the math, Magoosh was bomb. Okay. Can you describe your role as a PA in the ER? Yes, my role as a PA in the ER is very similar to a doctor in the ER. I see patients like a doctor. I log in. I log into our EMR system, and then it shows the tracker board of all patients to be seen. I pick up a patient, of course, look at their vitals, look at the triage note, look at their past history, and then I see patients just like the doctor. Typically, it's all patients will have an ESI level. That's just their level of acuity or how sick they are. And let me stop for a minute. I did do a past eShadowing session on the ER, and I also did one on another eShadowing platform on YouTube. If you probably even search my name on YouTube, you'll find it. I can put the link to those at the end of this session or on my Instagram. But if you really want to get in depth about like my work in the ER, like check out those videos. I'm just going to kind of do a run through really quick. So I log in, and patients are assigned an ESI level, their level of acuity 1 to 5. 1 is like the sickest patient, which I always say is like cardiac arrest, patients that are just like either dead or near dead. And then 5 is like, okay, why are you in the ER? Nothing's really wrong with you. It's like suture removal, something very simple that's not going to take up many resources. The ESI is based on their stability level, their vitals, which tells you how stable they are, and their the amount of resources you're going to use. So like somebody that's in cardiac arrest is going to need the most resources, or not even cardiac arrest, that's like a heart attack. They're going to need the most resources in terms of the ER. They're going to have all these blood work done. They're going to have all these tests, imaging, all this stuff that takes up a lot of resources in the ER. So they're going to be like a level 2 or a level 1. But somebody that just needs suture removal, they just need the little scissor, just take it off. So they don't really need any ER resources, and it's not going to be like a large bill likely. So yeah, the ESI is the number of resources, stable or unstable. PAs typically see levels 3 to 5. A lot of times levels 2s. It's all of this is really based on the ER, their culture, how much they allow PAs to do, PAs and nurse practitioners. So some ERs only let PAs work in fast track, which I don't recommend, because if I wanted to work in fast track, I would have just gone to urgent care. So I don't recommend working in those ERs, because like, why are you limiting my scope when I'm able to see level 2s and 3s? So I don't really recommend working in it, unless you're just getting started, yeah, but eventually you want to see sicker patients, not just coughs and colds. Fast track is typically like levels 4s and 5s, coughs, colds, sprains, which you would see in urgent care. Level 3s are like some heart patients, chest pains are all level 3s, unless they're an active STEMI, unless the EKG reads it as a STEMI. But chest pains are level 3s. Everything else, majority of stuff are going to be level 3s. Sometimes there will be level 2s, but we'll see like all level 3s, mainly level 2s. So we get to do all that. We can run codes, but it's not common. Doctors typically run codes. But other than that, we do everything. We do procedures. We do a lot more procedures than the doctors. They like us to do their procedures. And by procedures, I mean like incision and drainage, like if they have an abscess or a boil, suturing, splinting. Some ERs, the paramedics or nurses will do the splinting. Or you do it. That's kind of annoying to me, so I like it for the paramedics to do it. But splinting, that's really it. All procedures we do, and let me see. That's about it as far as like what you do. You do everything really the doctor does. Order tests, diagnose the patients, order treatments, medications. So let's see. What is the best way to shadow a PA? I also talked about this before, so I'm not going to discuss it too much. The best way to shadow a PA, like I said, it's really hard right now. So I recommend creating a LinkedIn account and finding a PA on there. I said it last week, so I don't want to go too in depth and say the same thing. So I recommend going on LinkedIn and making a really nice profile. LinkedIn is a professional site. Creating a really nice profile, highlighting, all your strengths, everything you bring, what your aspirations, and also attaching your resume, creating basically a nice profile of yourself, because it's a professional site, as I said, and then reach out to PAs in your area. And with LinkedIn, once you friend request somebody, there's like an intro message. So of course you don't say, "Oh, I'm looking for a PA to shadow." You say something like, "Oh, hi, my name is such and such. I'm a pre-PA student. I'm interested in learning more about the PA profession and would like to, form a connection with you." That's it. You don't right then and there ask them to shadow. You follow them, like their posts, make a, smooth, landing into their DMs. So you do that, and then follow them for a few days or weeks, and then you message them. They'll see that you've been liking their posts, you've been commenting on stuff, and then you go in and ask them. Because right now it's like you can also call random doctors' offices, but I think if they see who the person is, they're able to like look at their stats. It's easier to to form that connection and get a shadow person during this time. So with how competitive, I have not taken the PA CAT. I've been a PA for almost 5 years. It's been 8 years now that I applied to Caspa, so I'm kind of old. So back then there was no PA cat. So unfortunately, I don't have much to say about the PA cat. I'm sorry. If anybody can answer that question for them. With how competitive PA school is, what do you think is a safe patient care experience or volunteer? Volunteer, I don't think it matters. Volunteer should reflect who you are, something fun that you like to do. If you like to bake, and you bake for fun and you're going to join some baking club or whatever, awesome. That shows that you're well-rounded. Volunteer, don't have everything focused so much on healthcare. You know, they want to also see that you're well-rounded. So don't just like, don't let it just be all healthcare. Volunteer work should not just be healthcare stuff. At least I think so. I would like to see different volunteer work. So if you like to help the homeless, help the homeless. If you are into dancing and you dance and you do some type of volunteer work with dancing, do that. But as far as patient care hours, then everything is safe to me. As long as you're touching the patient, that's patient care hours. As long as you're touching and interacting with the patient. Like I say, always CNA, home health aide, patient care tech, radiology tech, ultrasound techs, anything where you're touching and interacting with the patient. Let's see, what else? I like scribes. Some schools don't want scribes, but I like it. Let's see, what else? Yeah, anything where you're interacting with the patient. Okay. Sorry, I had to scroll up, guys, because there's a lot. Dang. When do students typically take the GRE during undergrad? I recommend your senior year. Because usually your senior you don't have as much of a caseload, right? I would hope that you're not taking, like, my senior year, I was not a full-time student the whole time. I was like, I'm done with school. I'm done with college. So usually, like, your the last semester of your senior year, I don't recommend any. I hope, like, by then you're basically done with all your credits. So you have time to study for the GRE. So take it, relax your senior year. Don't do so much. If you're almost done with all your classes, just take some time off as you prepare for PA school and study for the GRE then. I'm not really going to answer personal questions. A lot of these questions I wanted to be general. If you guys have more personal questions related to your stats or personal help, then just email me. My computer's slow, so I'm trying to type in my email. Okay, here it is. Or DM me. Yes, this will count as credit. All shadowing sessions count as credit. Can you talk about how we should write our experience descriptions in Caspa? I recommend it not to be too long. Write it how you would write it on a resume, literally just like that. How it is, you have a short description on, like, your resume, that's it. How many PA schools should I apply to first go around? I also answered this last session. Maybe I shouldn't answer repetitive questions. Well, it's not repetitive. Of course, it's important to you all. But if I answered it before, I want to give others a chance to get their questions answered. Their non-personal questions, general questions answered. So I always recommend applying to more than one school, of course. 4 is a safe number. Everything is up to you. It's up to, what you can afford, where you want to go, where you want to live, your debt, like how much debt you want, how much debt you want to be in. And how much money you want to spend with applying, as I said, because Caspa is not cheap. So 4 is a safe number to me. Okay. I ended up applying to 12 schools. My original number was 4, but I added more schools. I did interview at a third of those schools. So I interviewed at 4 schools. The rest, I did get interview invites, but I just didn't want to. The 8 schools that I applied to were out-of-state schools, and I applied to 4 in-state schools. But I was able to interview at all the in-state schools that I wanted to go to, so I didn't even bother looking at the out-of-state schools. But it's up to you. 4 is a safe number. Definitely don't apply to 1 or 2 unless you're really fine and you're you're confident with your stats, sure, but more than 1 or 2. 4 to 6 is a safe number, I think. I know PA school is very, very, very competitive. If you want to apply to 15, 20 schools, sure, like if you don't mind. But I don't know. I honestly don't, like, I know it's more competitive, but I just don't want to, like, it's weird telling people to apply to like 20 schools. I didn't even apply to that many schools for college. But y'all are overachievers. I'm kind of basic. I'm sorry. What do you love most about your job? Okay, I'm real too. So what I love most about my job is that I can see patients, treat them, and then, treat them, watch them. I like the fact that I see them, I meet them, I see them, and then kind of see them through, like see them as they get better, like as they improve. A lot of times, of course, that's not the case, especially if they get admitted. But so say they come in for like, or even if they do come, they do get admitted. At least you know what's what it is going on. Like they're more a lot of times you get to that diagnosis. So that's what I mean by kind of seeing them through, seeing everything through as it, progresses. And I like that it's also a learning opportunity. I'm always learning, constantly learning new things, especially when it comes to diagnosis, when it comes to labs, because nothing is ever like just textbook. You're just, something's always weird. I'm always kind of Googling something or looking something up on UpToDate. But yeah, I love the fact that like finding out what's going on. So my favorite complaints are abdominal pains, because like more likely than not, you're kind of gonna know what it is because you do a CAT scan, or based on where they're having the pain, you get to like that differential easier and how they describe the pain. So I love abdominal pains. Yeah, because if they come in with abdominal pain and it's like right lower quadrant, then you can know, oh my gosh, it could be an appendicitis, or if it's a female, or oh my gosh, it can be a cyst. So I had a female patient that had right lower quadrant. No, what is it? Right lower quadrant? I think right lower quadrant pain. And I thought like, it could be appendicitis. Yeah, I thought, no. She had right upper quadrant pain. And I was so convinced that it was her gallbladder, because the gallbladder is right upper quadrant. But all her LFTs were normal. She didn't have a white count, nothing. So I did a CAT scan, right? And she had a ruptured cyst, that like a right ovarian ruptured cyst. And I'm like, why is she having right upper if it's like, but she had some free fluid, which is what happens when you have a ruptured cyst. But it's just like, you kind of find out, okay, this is likely what's going on with your pain. And I like that, that like doing that specialty, that's what, comes with working in the ER. It's such a mystery, finding out that like guessing the puzzle, or putting the clues to the puzzle together and finally figuring it out. And you can tell the patient, okay, this is what's going on. Or even if you don't figure out what's going on, you can say, oh, this is what I think is likely going on. And then I think that you should see this specialist, or you should follow up with this person to make sure that, everything is okay. So I like that. All right. What year in undergrad should someone start clinical hours? Don't even wait for undergrad. If you know that you want to be a PA and you're in high school and you're old enough to take a CNA course, do it immediately, because you need all those hours. All those hours are so important. As soon as you know that you want to be a PA, start taking your clinical hours, your patient care hours. Do you have any PA colleagues that completed a master's or post-bachelor? Yes, I have a lot of colleagues. If you guys, I hope the videos are on YouTube, but Brianna Grant, she completed a post-bac program, I believe, to help her application, and I think to also help her GPA. A lot of people do. I'm not against that. How do you feel when patients say they want to see an MD over seeing a PA? Okay, you could do that. That don't change my pay. I'm still get paid the same. Okay, of course, that's not what I tell them. That's what I'm thinking. But So of course, all that is kind of like comes with ignorance, just not knowing enough about the profession, which, I don't blame patients. They want to make sure they're getting the best care. And like I said, it's just all ignorance, and it just can be a teaching opportunity. So I explained to them what I am, my duties, that I likely am able to treat them as a physician. And I tell them that I also collaborate with the physician. So if there's something that I'm not sure of, or that I, want, more understanding of, or, have a question, I discuss it with the physician. And if they're still, wanting to see the doctor, I'll tell the doctor. And the doctor, a lot of times they don't mind. And even if they don't like what I want to do, half the time the doctor don't want to do less than me. Like if I say, oh, I don't think that's necessary, or we should do this instead, or whatever, the doctor would be like, oh, don't do it. Like they don't need anything. Like a lot of the doctors are more conservative when it comes to ordering tests, and especially the older doctors, and the patients don't like that. They want to know what's going on. And that's also what I don't like about the ER. I don't like the fact that the patients tend to have this savior mentality. Like they expect us to cure them. That's not necessarily what we like, that's not always going to be the case. Patients come to the ER looking for answers, which I understand, but we won't always have the answers. And they'll be like, oh, I'm having this. What's wrong with me? Tell me, I came here for answers. I need to know this is literally what they tell me. I need to know what's wrong with me, or else I'm not leaving. Like half the time you won't find that in the ER. More than half the time, our job is to make sure that you're stable, that you're not going to die. Emergency room, it's in the name. Our job, as long as we can say, okay, you're stable enough to go home, and then follow up with such and such to make sure that everything is okay, or to make sure there's nothing underlying going on. That's what I tell my patients. But they want to know so bad, and I understand it's stressful and it's hard, to be in the dark when it comes to your own body, but that's really not what the ER is for. That's your primary care doctor. It should be telling you, especially if you have a chronic condition, they'll have something that's been going on for weeks or months, and then they want to come to the ER. Like, no, if you've been surviving it for weeks, that's not an emergency. But it's hard to tell patients that. And they also think they're going to get those answers from the doctors. And no, a lot of times the PAs are kind of a lot more patient with patients. But yeah. Which ER hospital you work in? Also, have you switched professions before? No, I've never worked in a profession. I guess I have. I was an LPN before. That was just, I was so young. So to me, it wasn't a profession. I was an LPN when I was like 18, 19. So it wasn't necessarily a profession for me because I was still in school. I did the LPN program in high school, and that's how I was able to. Let me put this laptop down, because every time I shake my knees, it like moves. But that's how I was able to do it in high school. I get my LPN license and work in college. So PA is really my first profession. And I work at an ER right now, I'm actually based in Georgia, in Atlanta, Georgia, but I'm doing a travel job in New York right now, in Brooklyn. It's so distressing that I do not have any PA shadowing. Yes, this is PA shadowing hours. How has your role changed with the pandemic? My role has not really changed. One thing we did in our ER is open up like a COVID area where like all upper respiratory complaints, all possible COVID complaints get seen in a special area. If they're stable, if they're unstable, they go to the main ER. Or if they appear unstable, like their vital signs are not perfect or stable enough. But if they are, then they go to our, like, this designated area in the hospital. That's only, my role hasn't really changed. If I plan to take a gap year or two, I have to retake classes that I took during my freshman or sophomore year of undergrad. No, it depends actually. Well, it depends when you took those classes. If you took classes 10 years ago, you have to retake them, because there's that deadline for classes for prereqs. So I believe it's 10 years. So if it's been more than 10 years since you took a class, yes, you'll have to retake them. But if your gap year is a year or two, and you're like going to be 6 years since you took those classes freshman, sophomore year, you should be fine. Do PA schools care if you have to retake a few bio and chem classes because you didn't pass the requirements the first time around? Yes and no. No, they don't care if you took like one or classes over. But if you had to take all these classes over, your GPA is not good because you keep failing your science classes. That may be a red flag because why do you have to keep taking them over? But if you like failed like one or two classes, that's fine. Or if you got one or two C's, that's fine. Any ways to shadow a PA in person? When I gave you guys that advice about the LinkedIn, that's for in-person shadowing. That's to help you like connect with PAs in your community to shadow them in person. So if you like go on LinkedIn, because like I said, what I had to do was use the yellow pages. I literally called doctor's offices from the yellow pages. I went through, the list, or you can Google doctor's offices in your area and use the use the computer or the yellow pages. So I only suggest LinkedIn because it's a more personal connection, and they'll probably feel more comfortable because they see the person and they can see your stats, they can see your resume. So that's why I suggest that. It's for in-person shadowing. If I want to start PA school this semester after I finish undergrad, when should I apply? You should apply your senior year. Or, your senior year. Because this is your senior year. You would apply your junior year. It depends when school starts. So you would apply your junior year, you interview, right? No, your senior year. I have a brain fart. Right now you apply your senior year because you would start the next year. It's basically like medical school. So you apply and then you start that next year. If you are taking a gap year, should you apply to PA school your senior year? No, I applied to PA school. Yeah, okay, if you're taking a gap year, you apply to PA school, yes, that senior year. Cause you graduate and you're gonna graduate while the interviews are still going on, right? So usually people graduate in May. So Caspa opens in April. So you apply and then you graduate and you're done with school. And then you're done with school, and then you still have a whole year to start. So yeah, so if you want to start right after, then you apply your junior year. So then you start right after your senior year. But it's kind of a little tricky because it really depends on when that program starts. So some programs may start in May, some programs start in August. So it's just making sure that it doesn't start like, it doesn't overlap with when you graduate college. So one of our classmates, we started in May, and she graduated like right before PA school, and she barely had a chance for anything. So we started like May, like after Labor Day, and she graduated like 2 weeks before. So that's what I mean. So yeah. So if you want a gap year, you do apply your senior year of that application cycle. So if you're a senior right now, you're basically going to have a gap year because you're not going to start PA school in May. You're going to start PA school the next year. As a PA, are you expected to get the COVID vaccine? As a PA, they recommend it. They definitely recommend it. They would love for you to get the COVID vaccine. Is it mandatory? No. PA student, is it mandatory? I don't think, no. The COVID vaccine is not mandatory for anything at the moment. For travel PA, do you have to get a different license for each state? You do, yes. Some states are easier than others. California and New York are definitely easy. Texas, be tripping. Texas wants you to take some stupid tests. I'm not on that, but I would love to work in Texas. But do I have no, I don't have a California license. I have Florida, Georgia, and New York. But they were all easy. Florida, Georgia were super easy. Like states that require extra tests and stuff, why? No. How is training for a job as a new grad? That's a great question. So you guys might not remember this because you have to, finish school and then get a job as a new grad. So I always recommend you get at least 6 weeks of training once you graduate and start a new job. You're going to, it depends where you work. If you're working in surgery, you're going to be training for probably a lot longer than 6 weeks. And you're going to work very closely with the doctor. But in the ER, I did 6 weeks. Was it 6 weeks? How come I don't remember? I did. No, it wasn't 6 weeks. It was like a week or two, like just with a PA, like with a PA by myself, or with a PA, and then I was by myself. Like I think I was working every single day with that PA or any PA or nurse practitioner, and then I was by myself after like 2 weeks. But they had me present every single case to a doctor before I left. So that's how training was like for me. Every ER is different, but like I had to present to doctor every single case, before every patient left, I had to present. And I think that was fine because I gained more confidence. The doctors taught me a lot. So I think that was I like that training that I did. But other hospitals, they make you train 6 weeks with a where you present to a PA or you present to a doctor or you work with the PA closely. And yeah. Usually it'll entail you like presenting to somebody constantly for 6 weeks. But that's for the ER. I'm sorry, there's so many questions coming in. I know I skipped some. Like this chat is just hot right now. I like to like see what you guys like, your little commentaries, and I'm not even able to read them and be entertained. Can I include into my application healthcare experience before I started my undergrad? Of course, yeah. If you have healthcare experience from like 10 years old, include that. I would. Is healthcare experience. You got skin in the game. Would you say being a PA allows you to still live your life outside of work? Yeah, I'm living my life right now. Yeah. So yeah, yes, it definitely allows you to live your life outside of work. That's why I also like it. Right now, I basically make my own schedule. So I like work like a slave for 3 weeks, then I take like 5 or 6 days off, and then I go do my life. But that's because I make typically in the ER, you'll give your days, your availability, and they try to fulfill those days. And so that's how it is. But me as a travel PA, I just give them my availability. That's it. And they basically abide by my availability. So if I say I'm not available this day, they give it to me. That's it. Because I'm not available. Because I only work for that agency. So I always get my days that I want. So, and I always get my hours. I really like working, but then when I want my time off, I want my time off. So I'll work like I typically work over 200 hours a month, but then I like put like 5-7 days off just for me to do me. So for like 3 weeks straight, I only get like 3 days off in 4 weeks, and then like that last week of the month, I try to just relax. How did you get the opportunity to travel to New York? I got the opportunity because a friend sent me a DM about it, and I was like, yes, I'm about to hop on board because this pay is phenomenal. So I found out about it through a friend, and then she told me about a Facebook group for all travel opportunities, all COVID travel assignments. So that's how I found out about it. But the Facebook group has a lot of travel opportunities, and I wish you guys were new grads because there were also some opportunities for new grads. And they were paying like $80-$90 an hour for new grads, which is awesome for a new grad. Do you have any thoughts on how you think COVID will affect the PA application process? First of all, a lot of interviews are going to be like this, virtual. I think that's going to affect it. And I hate that. I hate that. It sucks because I love the fact of meeting in person, shaking hands, building that, that connection. You look eye to eye. They see your full outfit. They see that you mean business. They see your little briefcase. Like, I like that appearance. You guys, appearance is everything to me, okay? It tells them how serious you are, that, you're ready. Like, you come in with your little briefcase, with your suit on, nice, fresh haircut. Like, you look super professional. I wish that you guys could experience that, or schools could see that. Because I think it really tells them that, oh, I'm ready. I'm, just on it, and you can, you get that moment where you go into your little briefcase, they ask you a question, or you pull out your notepad and it just shows that, oh, I'm just on it. But you don't get that, so I don't like that. I think that's definitely how it'll affect the application. And then I know there's a COVID essay. I recommend everybody to write a COVID essay, how COVID impacted your life. And then I think that, of course, in the application, in the interview, I'm sure all schools will want to know about like what you did during COVID, how it impacted you. So just be prepared to answer any COVID questions. So yeah. Yeah, when so I found out about the COVID opportunity December 3rd. I already had a New York license. Like I don't know, I actually wanted to like work in New York at one point. So I had that New York license already. So it was really easy for me to like get on board. I found out like December 2nd, and by December 14th, they wanted me to like in New York, and I started working like December 29th. So it was like 3 weeks. How do you go about becoming a travel PA? It's really easy. You connect with a recruiter for locums. It's called locums. Locums is basically you're not permanent anywhere. And I like that because I can't be nowhere too long. I'm goofy, y'all. So you're not permanent anywhere. So you'll have assignments for different periods of time. So some may be 3 months, some may be 6 months. So you just go online, Google like a recruitment firm, and it'll say locums, permanent, blah, 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 moonlighting. Locums is the travel work. And so you connect with the recruiter. They tell you like any locums hiring in your area or anywhere in the country, and you negotiate, or you send them your resume first. And then they'll send that resume to the job that wants you, or the job that's looking, and then they'll say whether they want you or not. And then you can, negotiate on a pay, and that's super easy. And they help you with everything. But like recruiters, if you're working with a recruiter for even a permanent job, they're gonna help you with everything either way. Like they'll help you with the whole application process, with licensing, with getting everything needed for that state, everything. All you got to do is they'll send you a bunch of paperwork, you fill it out, and they do everything else. For including virtual shadowing experience, what could we use as the contact for the shadowing session? You can use eShadowing.com. Contact information, everything is on there. And of course, my information, I gave my email and my first and last name already. And you can put my title, all that. You can I think it's important to put a good description of virtual shadowing, what it entails, that you're just not sitting here watching me talk, that you're asking questions, that you're learning more about the profession. Emphasis on learning about the profession. Why did you choose to become a PA over another type of provider? Because PAs rock. It's like going to med school without the school. Just kidding. Okay, but really, like I didn't have to do school forever in 20 years. Okay, that's why that was really for me. It's what's important for you. So you're all really young right now. You're all really young, but you have to consider your futures. So I've always been the type of person that always thought about like long term, what is going to be important for you? Do you want kids one day? Do you want stability? Do you want this? Do you want a certain lifestyle? Do you want a certain pay? Do you want, not to stress your whole life? Do you want your job not to be everything? Like, what do you want for your life? Okay. Yes, you love the medical field, but what do you want also for your life? And PA just fit that. It fit the type of life that I want. So that's why I chose PA. Like I said, it's very flexible. I didn't have to go to school for forever and 20 years. That was a big thing, that I didn't have to go to school for forever and 20 years. I did 2 years and 3 months of school. That was it. Came out making some money, able to pay my student loans at a reasonable time, able to make some money at a young age, some really good money at a young age. And that's what's important for me. And that being able to go from specialty to specialty, career to career, you see, like I've already done so much. Like I was able to leave and go to New York and work. I mean, and there, look at all the opportunities that come with it. So that's why I chose it. How is work-life balance working as a PA? Work-life balance is great. How often do you have to be recertify. So we take so when you graduate, you take the PANCE. And it used to be that you take the PANCE every 6 years, but now it's every 10 years. I'm like at the halfway mark. So I have about 5 more years to take the PANCE. So you do. And that sucks because I don't think there's any specialty where you have to recertify. And then, of course, not so you take the PANCE every 10 years, but like every 2 years, you gotta you have to take you have to renew your license, your state license, and you don't take an exam for that. You just do your CMEs and yeah. And then also for NCCPA, you have to like do your license, your CMEs every 2 years with them as well. Most PA schools start like colleges in May, August. Caspa opens in 3 days. Okay, I'm trying to see any more questions. Did you work while in PA school? No, it is going to be very hard to work while in PA school. I do not recommend it. Okay, that's a good question. How much does stress play into your job? Also, do you take any work home with you? Let's see. Yeah, my job can get very stressful, especially towards the end when I'm trying to leave. No, but my job, it's not as stressful as it was when I first, started, of course, because now I'm more comfortable and I know, I know more, I guess. But it can get very, very stressful, especially. I'm trying to say why it can. It's really politics. Why it can kind of get stressful. Kind of trying to have to meet the like times for different things, and well, back in Georgia, they wanted you to see a certain amount of patients in an hour within a time frame, but I don't care about that. But I care about the patients. I don't care how long it takes me to see a patient as long as I'm providing quality care. But yeah, it gets stressful because you want to make sure you're not missing anything, that you're doing everything that you can for that patient. And do you take any work home? I used to take work home. I don't take work home anymore. I would rather stay over than to take work home. And in Georgia, I took work home a lot in the beginning, but then I didn't anymore. Take work home as far as charting. How does your role as a PA differ from the physician's role in the ER? Of course, the physician is my supervising physician, so all my charts will be under the physician. As far as they have to sign off on those charts, and I work alongside the physician, so I collaborate if I have a question. If I may present a patient to the physician. If I'm unsure about something, as I said, they don't have anybody to what's the word? They don't have anyone to, I guess, I forgot the word, but like they don't have a supervising. So to me, that's really the difference. We do a lot of the same work. I guess the liability may be different, but it's a lot of the same work, ordering a lot of the same things. A lot of times also, if I'm thinking about admitting a patient, I may not just go right to admitting that patient. I may talk first with that supervising physician to make sure, okay, this person is, definitely needs to be admitted and not just go home. So it's just a lot of the same work. How do you retain the knowledge you learn in PA school and use it in the clinical setting? That's weird, right? That you're able to retain that knowledge. I don't know, but everybody's smart enough to do it. No, because that's a good question, because somebody said, how do you retain the knowledge you learn in PA school and use it in a clinical setting? But it's like, it's weird because you think, oh my gosh, I'm never going to remember this stuff. Oh my gosh, I'm never going to learn this. And you get scared and you lose confidence and you're not sure how well you're going to do as a PA. But you do it so much that you retain it, and you're going to do enough rotations and speak with enough patients and, practice this enough that, it sticks with you. And all of you are smart enough. You guys have got to remember that you're smart. You're very smart. You're taking all these crazy science classes. You're, doing all this for this. Like, you're smart. You're going to, trust me, you're going to learn it. I don't know how, but you learn it. And it's not, you retain it because you kind of learn the disease process. So you know that this is happening because of this. So it's like solving a puzzle and putting the pieces of the puzzle together. Do you work with your supervising physician? I know some PAs do not work at the same place. Okay, in urgent care, I don't. In urgent care, I basically work by myself unless I work with a doctor that day, and that's not typically the case. In urgent care, I work by myself, and they assign me a supervising physician for that day, and the supervising physician is never there. And I just, assign them to my charts. In the ER, at least the ER in New York is completely different. So I do. The ER in New York, I work alongside them very close, which I'm not always a fan of. I'd rather them kind of do their own thing and I do my own thing. And if I need help, and I go there, but it's kind of micromanaging a little bit to me. But every place is different. So in the ER in New York, I work a lot closer with my supervising. Some supervisings, they like you to present every patient before the patient goes, and I will. Some supervisings, they're fine as long as everything's okay, and then they just read through your charts. Some supervising, they like to go through the list, which is fine. But in Georgia, I do my own thing. I don't even talk to the supervisings. They'll work the shift with me, but they'll be like on a completely different side of the ER doing their own thing. So we're a lot closer in New York. So that just goes to show you, it really depends on where you work. Hi, Rodeline. Would you recommend specializing in family medicine first before going into the emergency room? Let me see. It's a good experience, but a lot of places say that, a lot of emergency rooms tend to not hire new grads, but I actually think it's a great place for new grads to start working, especially if you can start off in fast track and then go to the main, or start off with lower acuity patients and then go to the main. Because family medicine, yes, it's good, but you're not going to see those emergency cases. So you want to be able to see like higher acuity patients and get used to that. Family medicine is a great way to just get experience overall. Awesome way to get experience. But as far as the ER, you'll get that experience, that general PA experience. But as far as like seeing sick patients, the ER, like nothing beats the ER. Urgent care is a good stepping stone, but I think family medicine is great too. But most ERs, they don't have, they don't say, oh, we want you to have ER experience. Most ERs just want you to have experience just as a PA, period, before you go to the ER. Do you ever wish you were a physician so you could work independently? No. I don't care about that. No. No. The only thing about, in my opinion, because I feel like I already kind of work independently. The only thing that I wish is the pay. That's it. How do you balance the pressure of meeting certain numbers, time constraints versus providing quality care? So I'm just one of those providers that don't care about the numbers and all that. I'm just kind of focused on doing preparation. I probably shouldn't have said that on video, but I don't care. When I see those stats and stuff, oh, this person saw 20, 30, 50 patients, I'm like, okay, no. I just do my thing. I make sure that no patient ever, has to suffer in my care, has to have an adverse reaction in my care or adverse event. And that's what I care about. I just make sure I do enough to where I can sleep at night. That's the number that I care about. But of course, you want to make sure that, you do what you got to do to meet those numbers for the hospital. Sorry, guys. I'm just being me. What is your relationship like with nurses and other ER staff? What is your communication like with them? I absolutely love the nurses and the ER staff. I found that I like the younger staff better. I mean, I guess just because we have like that vibe, that millennial vibe or whatever better. But but I'm sure you guys see my personality. I get along with everybody, so I'm very patient. Usually, if somebody doesn't do something in time for me, I just kind of do it myself. Unless I need help, then I kind of keep asking them. But I'm not argumentative. I'm not bossy. Like when it comes to getting something done, if a patient really needs something, like I said, I just kind of get it done myself because I understand everybody's busy. The nurses are just as busy, if not even busier than us, because they constantly have to, get labs and stuff done from other providers, not just me. So I get along with everyone. In your areas of practice, do you have a particular interesting case? I do have a lot of good interesting cases. I'll discuss them on the next Q&A. Would it be beneficial for me to volunteer at a hospital? Of course, definitely. It might be harder for you now because of COVID, especially in New York. In your course of studies in becoming a PA, what do you think you could have done differently? In becoming a PA, as far as pre-PA, nothing. I think I did everything great. As far as PA school, I wish I would have studied a little better, maybe. I wish I would have, studied a little better. I did study and I did well, but I was just still that like, oh, I gotta get an A person. And that's not what's important. It's just like learning the material. I mean, I did get an A and it did end up sticking with me, the material, but I just wish I wasn't so stuck on that, like GPA. While in PA school, how many hours a day did you spend studying? We would have school from like 8 to 4 or 8 to 5. I get home, I would eat and then try to go to the gym. And then I would just be studying all night. Like from like 7 or 8 until like 1 o'clock. A lot of that time is just kind of like being on social media, being on YouTube, goofing around, but I would study. Was it hard to get a job after PA school? For me, it kind of was hard, but that's because of my area. I live in South Florida where it's very saturated. They want people with like 20, 30 years of experience. Like I was trying to get into the ER right away, but they want people with 20, 30 years of experience, and it's super saturated. On all the jobs that they had back then was like surgery. If you want to go into surgery, you will never have a problem finding a job. Because surgeons actually love training new grads because they can because you're teachable. They can teach you to do exactly like what they want, how they move and everything. Because surgeons like their things done a specific way. But I do not like surgery, and it was just all these surgery jobs. It was so hard to get a job that I wanted. So I ended up working a little bit of urgent care. Then I did a little bit of addiction medicine for like a year. And then I finally got my year's experience to go into the ER. Have you ever faced any racial biases while in your PA program or in the field? If so, how did you handle it? Okay, yes, I think I discussed this before as well. So I'll answer this in 2 more questions. Somebody said I love surgery. Yes, so you're gonna be able to get a job almost like this, especially if you live in Florida. Yes, there were racial biases in my PA program. And as far as the PA field, depends where you live. So in New York, none at all. No racial bias because New York is just a big melting pot and it's really beautiful. And as far as the diversity, and you work with all these different people, so it's comfortable. And then a lot of the patients are, as far as where I work, it's like a large Hispanic and African American population, so no racial bias. But then for my PA program, I was in Naples, Florida. It was like a large, it wasn't as diverse. So I did face some racial bias. I'm not going to go too in depth, but I did face some. I had like where a patient didn't even want to see me, didn't even want me in the room, and there was nothing that I did. It was her very first time seeing me, an older woman, and she just said, I don't want her as a patient. I mean, I don't want her not as a patient. I don't want her in my room. I don't want her. And I was just like, I didn't even like introduce myself. I walked in with my preceptor and I didn't get a chance to say anything. I think he started to introduce me and then she just cut him off and said, I don't want her. And that's it. And then he made me stand outside and I sat outside and cried. Like it was like my first rotation. It was like the start of my first rotation. So I just felt terrible. And then my ER rotation, it wasn't even the patient. It was the patient's wife. She was just so mean. So I had my notepad, I had a clipboard, and I was like, writing down the history. The doctor told me, my preceptor had me go in the room, to get a history before presenting to him. So I went in the room, I shook her hand, and she didn't want to shake my hand back. Or I went in to shake her hand. And I mean, I get it. Like, people don't want to touch you, or, germs. And so I was like, whatever. And then so I'm like taking down the notes on the, writing things down. I don't have the best handwriting, but she like looked over to me like this and was like, what is that? Some type of African hieroglyphic? And I was like, no, ma'am, I'm, writing in English. Like, what was that? Like, African hieroglyphic? What? It's just ignorance, guys. It's just ignorance. So that's what she said to me. And that's, it was really on rotations. That's it. But yeah, so the racism and the biases, the racial bias, it comes with where you work. It comes with that area that you work in. So if that's something big for you, definitely go to a PA school that's more diverse and ask them questions about it too. Ask them, the program too. Like, how diverse is their program? What are they doing about racial biases? So yeah, definitely. Yeah, it was terrible. It was terrible. And I'm not as like this. I wasn't like this, like just brush it off. I was a little more sensitive, so I cried. Yeah. Yeah, you definitely get tougher skin as you like start working, and especially being in the ER, you definitely learn to do this. Just do this. Yeah. Oh, thank you guys. I'm just seeing all these. I'm so sorry. I'm so sorry. Okay, so somebody said talk more about addiction medicine. Okay, addiction medicine is its own field. It's like kind of under the psychiatry umbrella, but it's just about addiction. And I honestly didn't know addiction was such a problem in the country until I started working in addiction medicine. So they have, there's rehabs and inpatient and outpatient treatment facilities. And, there's providers that these patients have to see that give them medications to stay sober, basically, I guess. They have to see them for that. And in detox facilities, before you actually go into inpatient or outpatient treatment, you have to go through detox first, unless you self-detox. So, and that's for any drug or alcohol. So I'm talking about addiction medicine, guys. So I worked in a detox and I worked in outpatient. So detox is when they're coming off of a drug and their bodies, they go through withdrawal. And then there's certain drugs or substances where you can definitely die. You're at risk of dying as you withdraw. That's benzos, alcohol. You can die like cocaine. Well, you can die from cocaine overdose or cocaine use. But yeah, benzo is really an alcohol because you're at risk of having seizures. So you really need to properly detox from those substances specifically. Like opiates, I mean, yeah, opiates, you go in a detox for that, but it's just you're going to feel crappy. You're not necessarily going to die. But benzos and alcohol can definitely kill you. So people go into detox for like a week or so and it really depends also on how long you've been using these substances. So, because if you've been using benzos for a long time, you may need a long taper of a specific benzo. So I was running that well, I wasn't running it. I mean, I was basically running it actually. The doctor kind of gave me like a protocol for each substance. And so I would see the patient, find out what they're detoxing from, their symptoms, and then see how much they would need of each thing or each medicine, and what we're going to do. And I would treat them based on their symptoms. And, it's an inpatient facility. So it's a 24-hour facility. So I basically rounded. I would go in for like 2-4 hours and then that's it. And I would make some good money. But I would go in like every single day, especially if there were like new patients to see. So, and that working there was actually very, 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 very sad because there were so many young patients, but they were very sick. A lot of them, and it was weird to see because I was like in my mid-20s at the time, and a lot of them were even younger than me. And it's like, seeing the parallels in our lives, like how they, their lives ended up this way because of some of the decisions they made. And I'm over here trying to be like a savior, trying to also be like a little therapist and give and pep talk them and tell them, and tell them, oh, we can change your life. Like this is, stop doing this. We can work on this to get your life, in a better place and that and whatever. And, because I cared about them. So it wouldn't only just be detox. We're just kind of giving them pep talks to making sure that they get through it. So a lot of them were like between the ages of 18 to 26. And they were on like heroin, cocaine. They tried any and every drug. Sometimes they would sneak drugs into the detox. A lot of them would have Hep C already. They'd be like 22 with Hep C, teeth missing because they like snorted. They chewed meth. So it was really hard to see. And so I helped them and treated them. And then once they graduated from detox, they would go to outpatient or inpatient treatment, and it would just be kind of like a continuation of it, making sure that they would always take drug tests and treat a lot of the times they'd also have a mental illness, whether it be anxiety, depression, schizophrenia, whatever. And I would also be treating that, refilling their meds, weekly visits. So yeah, it was interesting. Yeah, people definitely undermine that like addiction medicine and substance abuse when it's such a big problem. And these patients that I was seeing in South Florida, a lot of them weren't even from South Florida. They were from like the East Coast, and their parents would bring them down to Florida for treatment. How come your preceptor didn't have your back? I don't think that he necessarily didn't have my back. I think that like he when he walked out, he was just like, oh, don't mind her. She's a witch with a capital B. And I was just kind of over it at that point. I think he just, I don't know. I think he just, maybe he was already taking care of her for some time now, and he knew how she was like. And sometimes you just, some people, you just can't change them. Like you can't like expend that energy, especially when, they're just there for a certain period of time. And she was like in her 80s, she's set in her ways. So I didn't think anything of it for him not to say anything to her. Alrighty. Any more questions? Oh gosh, it's 8:08. Okay, guys. So there is a quiz after this. Like I said, we're going to continue with our a guest next week. I'm excited to have her. So get ready for next week. So have a good night, everyone. I hope you guys enjoyed this. I know it was super unorganized and just me being a wacko. No, would you recommend creating a Caspa account to see what classes we need to take? This for the programs we want to apply? No. Don't create a Caspa until it's time. There's frequently asked questions, and then the programs you want to apply to have, if you go on their website, they'll have a list of the classes that they recommend. And then there's general classes to take as well. But if you go on Caspa, or if you search like AAPA, PAEA, all these PA websites, you'll see the general classes for PA school. No, don't create a Caspa until it's time for you to create a Caspa. Trust me, you'll be ready for it. All right, guys, have a good night. Enjoy your night. Enjoy your week. Bye, guys.